In every low-income community around the country, there are programs that work to provide ladders of opportunity to young people. I think it is a mistake for us to suggest that somehow every effort we make has failed and we are powerless to address poverty. That's just not true. The poverty rate has been reduced about 40% since 1967. Our job is to guard against cynicism and not buy the idea that the poor will always be with us and there's nothing we can do. Because there's a lot we can do. The question is, do we have the political will, the communal will, to do something about it?
I'm feeling the love. It's up to you. Love is real.
I'm a social worker who grew up during the war on poverty. That's when I was trained, where we thought if we put the right resources together, intervened properly, we could save the world. Little did we know that it was too little, too late. If you have 3 generations of poverty, people are stuck.
Poverty, like race, is a clear risk factor for preterm birth and for infant mortality.
We have probably the highest African American infant mortality rate in the nation, in the city of Cleveland.
There are zip codes in Cleveland in which every mother of childbearing age knows someone personally who lost a child before the age of 1.
Ultimately, medical causes result in about 20% of infant mortality, and much of infant mortality relates to other issues, many of them socioeconomic.
The poverty is so high. They're growing up where there's generations of people living in a household that there's definitely not enough beds in the house. How do they get out of that? How do they break this cycle for themselves? They sometimes can't get it from the people in their home because people in their home don't know how to break the cycle themselves.
What this says is, you're just not getting there early enough, pal. Get there when the young mother is pregnant, before the baby's even born. Give them 2.5 good years of incredible support and resources and emotional connection and see what happens. And what happens is 15 years later, the kids are far less likely to be in the juvenile justice system. They're far more likely to do well in school. And the whole family, not just the mom, but her mom or her sisters and brothers are all sort of stepped out of this poverty cycle. It's incredible.
I knew that our infant mortality was not good in Cleveland and Ohio. Actually, we got an F on our report card from the March of Dimes. And I think that the city and the county decided that this was not a good reflection of our community. And the First Year Cleveland, Metro Health, and other agencies, including Mount Sinai, decided to do something about it.
In order to benefit the child, you must also pay attention to the needs of the mom. This is what's known today as a 2-generation strategy.
It's an incredible thing for a new mother with no resources and very little support to suddenly have this miraculous Wonder Woman, advocate who's completely on her side. It checked every box of our mission. It improves people's health, and it improves the conditions of life around that, not just an individual person, but the whole context in which they live. So it was like dreamy, and it's proven. 30 years of stats.
The premise of the program sounded solid, and then when we looked at the data, we were really impressed.
And this is what attracts us to a program like Nurse-Family Partnership. In fact, in the prevention literature, Nurse-Family Partnership is among the highest performing interventions in this realm. I mean, right up there with seatbelts. That's how highly regarded this program is. The reason we approached Metro for operating this program was because of its vast experience in maternal child health.
What I find refreshing about the Mount Sinai Foundation, as exemplified in this program, is that they do a lot of analytics. There's a great deal of due diligence that goes on.
We learned about the existence of federal money to support evidence-based maternal-child home visiting. The federal program is known as MCV, the Maternal Infant Early Childhood Home Visiting Program, which was part of the Affordable Care Act. It has received bipartisan support. In fact, it just was reallocated for a 5-year period. But believe it or not one penny had ever been awarded in Cuyahoga County. We called the Ohio Department of Health and we said, hey, we're bringing Nurse Family Partnership to Cleveland. We'd like your support. And the department agreed. And so more than $1 million of MCV money has flowed into the Metro Health Program.
Mount Sinai started out as a hospital that was built to accommodate the training and care for the Jewish population, which was being neglected and excluded. As such, it also was exquisitely conscious, this hospital, of all the other people around who were being excluded and not cared for properly. So it went ahead to become a spectacular teaching and healing hospital. Metro has that same sense of mission and purpose and responsibility. We're not just here to treat people who can write a check or have good insurance. We're here to take care of the community. I love them for that.
The Nurse Family Partnership Program has become a public-private partnership with support at the local level because we get pass-through dollars from First Year Cleveland, the infant mortality initiative in Cleveland. We get monies from the state through the Medicaid plans and also the MCV monies that come from Washington. So not only do we get the private sector side, which has been the Myers Foundation, the Bruning Foundation, the George Gunn Foundation, Sisters of Charity Foundation, and of course Mount Sinai's $1.3 million, but we also have received all of this support from the public sector.
The soul of the program is the trusting relationship that gets established between the registered nurse and this new mom. We look for nurses who are passionate about this issue, whose mission in life is to make a difference for newborns.
One of my other co-workers came to me and said, Marie, I heard about this program called Nurse Family Partnership, and I think you would be perfect. Because they knew about my passion for teen mothers. Just in my life, how becoming a teen mother, then becoming a nurse, and my desire to mentor with other young teen mothers. Sometimes people don't do better because they don't know better. Even when I told my family, they say, Mom, that's just your life all around again. And now you're on the other end of it.
It's the ultimate anti-condescension program because, in fact, the nurse follows the mother's lead.
We let them lead their lives. They are the expert on their lives.
We work with these moms to help them solve problems. And it's about education, and it's not the hands-on clinical nursing that you're used to hearing about, but it definitely gets to the heart of what nursing is. I'm not going in there saying, well, this is what you need to know. They come to us and say, this is what I want to know.
So we just ask them questions. Through motivational interviewing is one of the techniques that we use with them to get at where they are in their heart and where they're trying to go. Encouragement that they know, oh, I can do this. I can stand on my own. I can do this. I can find success. That's what we offer to them. How do I raise this child to have better? What will I do with my own life? What do I do now? Where is my life gonna go? Because I remember a lot of people around that time telling me, wow, you just messed up. What are you gonna do? Your life is over now. I heard that quite often. Can I do better? How do I do better? Because no one's telling me how I can do better. But in Nurse Family Partnership, what's offered is a partner, someone who listens to them, someone who offers them resources and education.
I was a first-time parent, and didn't know anything about becoming a parent, so I was like, why not try something new? It's a great program. Being a first-time mom, you learn everything. I believe in the beginning it was every 2 weeks. And then it became, I believe, weekly because he was, coming. Then he was coming. And then after that, it went back to being every 2 weeks. I have 7 sisters and 1 brother. Yes. And Drayshawn is the first grandchild in 20 years. Oh, I've learned so much. I've learned so much from being like Sarah coming around, just the milestones that are coming, how to notice certain things. And then she gives me reading material that helps a whole lot.
Sharita is awesome. She's really committed to being the best mom that she can be and to helping her baby have the best childhood he could possibly have. I think the soul of this program is just to have moms who feel successful. A lot of them start off not really knowing what it's going to be like to be a mom and not knowing how they're going to go about parenting their child. And then this baby comes along and your whole world just kind of changes. And I think that happened for Sharita. She found out that she had a much higher purpose, and it was this baby, and they've grown so much. To me, that's the best.
Oh, I've changed for the better, most definitely. I used to go out a lot. I don't care for going out at all. If I'm not with Drayshawn, it's like I'm at work, and if I'm not at work, I'm with Drayshawn. That's all that matters. Anything else don't matter. Sarah, she gives me a lot of knowledge about, his health and what I might be concerned about. It's just straightforward. Hey, can I talk? No? Oh, okay. But yes, it's just straightforward. It's like, yes, I can help you, And she's never not available. She's always available. She makes it known that I'm always available. She's just a text away. Yep, just a text away.
It's hard to answer that question without sounding obnoxious or flippant. How can you put a price on the life of a baby? The value of a human life, of a healthy, well-adjusted child in Cleveland is limitless.
We get to see healthy pregnancies. We get to see our children being more safe. We get to see infant mortality numbers going down. We get to see mom become self-sufficient now. We get to see the little kids playing and opening books because we told them about reading to their children. It does feel like I went to heaven. It's just the perfect place for me.
The nurse-family partnership is like the perfect expression of Metro Hospital with its mission, backed up by the Mount Sinai mission, going out into the community and giving care.
I see it as expanding. I just want to see as many mothers take advantage of the program. I understand how this program will impact their lives for the long run. It's not those immediate fixes, it's those lifelong skills that they carry with them for the rest of their lives.
From what I can see in both the evidence base and in how this program is rolling out in Cleveland with our incredible Metro Health staff, I feel this is the best hope we have in breaking the cycle of urban poverty in Cleveland and giving our kids the best shot at life that they can get.
Love is real.